Hi, I'm Jen, patient educator here at PA Green Wellness, answering my most common questions. What is GAINSWave and what is happening to my body? So GAINSWave is a protocol. It's an application for a Class 1 medical device imported from Sweden. This is a structured approach. There are basically two different pieces of equipment FDA approved that are used in the United States for this treatment. Both are fine. We use Storz medical equipment here. And why it's called GAINSWave is because we ascribe to their specific protocol. I prefer it. It's most aggressive. It also allows for customization. So what actually is happening in the tissue is the wave is entering the body. It's acoustically generated wave. It's not an ultrasound wave. And it creates microtrauma to the tissue. It dissolves plaque in the vessels. It kills off, so to speak, old, tired cells in the erectile tissue that would benefit from turning over more quickly. Thus, it's considered rejuvenating. It's also considered to be holistic. And that's because there are almost no known negative side effects to this treatment. It came out of pain and injury repair. It's been used in that field for 15 years overseas. And because of its ability to dissolve scar tissue and rejuvenate, increase blood flow to an area, turn cells over. So it doesn't take a big leap to conclude that that would be great for an erection. And so that's when it made the leap into the sexual health field. So when patients receive the treatment, over the course of treatment, which is ideally over 2 to 3 months, they notice initial changes, then medium range changes, and then long-term changes. So I would like to be clear with patients that they aren't seeing just one change. And this determines when they start to see results in their body, because it's up to their body as far as which change the body is going to deliver first. So initial responses that we see are in patients whose body responds to the increase in nitric oxide levels that are just in the genitals, or the dissolving of the microplaque in the vessels. If this is a factor for their ED, this type of thing changes within the first or second treatment, and they see immediate results. Middle term changes that patients see is a result of erectile tissue turning over, becoming healthier, more responsive. This is also where men might notice a change in girth because the tissue is fuller and it's carrying more blood, and it's just filling out the organ internally with internal erectile tissue and external. And that's actually what is helping with the rigidity and the base of an erection that is strong enough to sustain penetration. Long-term results, which I consider to be pretty much the 5-star, is growing blood vessels. So there's a lot of layers to ED, a lot of factors that come into play that are all relevant. And the time to look at all the other factors that come into play in someone's life is during the course of the treatment. None of those things are going to grow a blood vessel. None of those things are going to literally rejuvenate tissue. Our role as far as helping patients overcome erectile dysfunction is providing tissue change. That's what we do. And there's no reason why a patient wouldn't see some sort of result from it. Medication, yes, medication is a factor. Healthy lifestyle or lack of it is a factor. Poor communication in a relationship is obviously a factor. Sometimes injury, scar tissue is a factor. So our role, though, is to change the tissue. And this is why I like to see a patient continue with a full long-term course. I really don't think 6 treatments is enough. I really see most results around between 8 and 12, especially if a patient is going for the growing of the blood vessels. Patients can actually see the blood vessels. The other thing that I want to mention regarding what is exactly happening in the body with this treatment is the breakdown of scar tissue, the actual dissolving of scar tissue. So scar tissue can present as little areas of like a dead zone in a penis where they just don't quite have flow. It can choke off blood flow. They maybe don't have feeling. It can cause the penis to curve during an erection for sure, but sometimes even without an erection, and it feels a little bit like, I always ask patients to palpate themselves, get familiar with their own bodies. It feels a little bit like tape on a balloon, and this is something that we can dissolve. I also want to mention the wave can reach the prostate. So we have patients who are pretty upset at their penis, but I can tell you when they come in with a prostate problem, they're just in grief. So anything a man can do to keep his prostate healthy, I always advocate that. That's the engine room of a man's sexual functioning and even orgasmic ability. And it's hidden up in there, and it doesn't get the attention that a penis gets.